Hello, everyone, and welcome to the Connect with the Myeloma Crowd Chapter. My name is Audrey Burton-Bethke, and I'm the Myeloma Crowd Community Manager. This event is brought to you by the Myeloma Crowd Community Program by HealthTree. I'm going to start by just sharing a couple slides with you so that we can do our intro announcements and have you get to know the people that will be speaking to you today. So let's get started. I'm grateful for your support. I'm grateful that you're here. I do want you to know this session is going to be recorded, and all registrants will receive this recording 24 to 48 hours after the event has concluded. We'll begin by thanking our sponsors as well: Bristol Myers Squibb, Amgen Oncology, Karyopharm Therapeutics, AbbVie Adaptive Biotechnologies, Genentech, Oncopeptides, and Takeda Oncology. So today we're going to be talking about tracking your key labs on HealthTree Cure Hub. We often hear from patients who are overwhelmed because of all that they have to keep track of. Some bring binders to their medical appointments, others try to keep track on their phone. There's just so many tests and records and labs and things that across different doctors, even and different specialists, you're trying to keep track of. That's why at HealthTree, we wanted to create a tool that would make your life easier, make your myeloma journey easier, and we created HealthTree Cure Hub. And one of the features in HealthTree Cure Hub is the ability to track your key myeloma labs. So I'm going to introduce you to the faces behind this amazing product. Today we have Todd. Todd's going to be on the back end answering questions. He's the head of product at HealthTree, and he is a IT healthcare executive who specializes in patient experience and clinical process improvements. Todd was the director of patient and provider experience at MD Anderson for over a decade, and he has a passion for using technology that can help patients have a better life and along the way help to further research for a cure. So again, he'll be on the back end answering questions along with Arturo. And then we have Anna and Patty giving our presentation today. So Ana Saun is an engineer and a psychotherapist. She's experienced in both fields and loves them equally. She leads our patient experience team at HealthTree, and she's passionate about talking to patients and empowering them. So if you have a HealthTree Cure Hub account and you've contacted her team, that's the patient experience team that have helped you with your account and different questions that you've had. When Anna's not working, you'll find her exploring the world, eating different kinds of food, hiking, or skiing. And then Patty is an international medical graduate who joined the HealthTree team in 2020. She's a part of the patient experience team. She helps patients understand and track their labs and genetic test results, which we're talking about today, as well as relevant information from their health history. She loves ballet, traveling, and reading a good science fiction book as often as possible. So Patty and Anna, the time is now yours.
Thank you, Audrey. Welcome, everyone. We are excited to have you with us today. So I'm going to share my screen and I'm going to start presenting. Okay, so today is our Track Your Myeloma webinar part 2. And we're going to talk about labs, genetics, HealthTree Connect, and how to use it. And how to print your summary for when you have an appointment with a specialist or a doctor, so you can take all your myeloma information to him. Okay, so I just wanted to mention that on last webinar, that was Track My Myeloma Part 1, and we discussed the diagnosis, your myeloma team, health and fitness, your treatment history, and full health profile. So what we did back then is we explained each one of those sections and how you can add all your information. If you would like to go ahead and watch that webinar, you can do so. Patty will share with you the link in the chat, and I'll ask Audrey to share with you the link also on the email that she will share about this webinar. So that was part 1, and we're going to start with part 2. So Patty is going to explain a little about labs, how to add them in HealthTree. Go ahead, Patty.
Thank you, Anna. Welcome all. So today we will be talking about labs, how to add them and how to track them. It is very important for you all to know the essentials about tracking your labs, specifically your myeloma labs. If you have any questions about what your lab test results mean or how to add them, you can always contact us. We will be there for you. You can email us at support@healthtree.org. and we will be able to answer any questions that you have regarding your labs. Also, we will be talking about genetics, and I know that it is sometimes very difficult to understand and interpret those results because of the difficulty of the subject. Sometimes genetics results are confusing, so we can also help you add them and understand them so that you can see the relevance to your myeloma journey. So first, we will be focusing on labs. We will see how to add them manually. I will also show you how to add them if you want us to help you with them, and how to track them. As I said, this is very important so you can see how you respond to treatments. It is important because as we saw in the previous HealthTree Cure Hub event, it is essential for the staging at the moment of diagnosis. And genetics can affect the treatments that you have and the prognosis long-term. So this is all very important and essential data to understand and to have in your HealthTree Cure Hub again. So let's begin with labs. First of all, we will see in the following section that you will have to go to healthtree.org. And if you already have an account with us, you can sign in using your email and your password. This is if you have previously created an account with us. If you haven't, you will need to first create your account so that you can start the onboarding process, and so that in the future you can keep adding, updating, and tracking all your information relevant to your myeloma. So we will see an example here. First, we would add the email. Then we would proceed adding the password, or you can also choose to sign in with your Google account. We will see an example here. We already entered the values, the email that we have to enter for our account, as well as the password. And you can choose for the system to remember your password and remember your login details. So you would just have to check remember me, but also take into account that this will remember it on the device. So if you would like for our system to remember your email and password, be sure to be doing it on a personal device. Do not do it in any other computer or cell phone. Be sure that it's your own device when you remember these login details. And finally, we would sign in so that we can enter our HealthTree Cure Hub account. Here we have an example of how you would see the dashboard once you enter your HealthTree Cure Hub account. And in order for us to go to the labs, which is the first section that we will be talking about, you would go on your left to track my myeloma and click on labs. Here is where we will be able to add all the labs that we want. And as you can see, this is the screen that you will see after you click labs. And you can see that we have several options for adding your labs. Again, I know that this could be overwhelming, having all this information, especially if you are new to HealthTree Cure Hub, especially if you have been recently diagnosed. So that is why we're here. We are here for you. And if you need any help, we can always help you do the onboarding process, help you add your labs. So do not hesitate on contacting us for any questions that you might have. So first of all, we will see the add new labs manually. For this, you would be doing it yourself. If you want to add all of your lab values by yourself, here is where you would click. And this is what we would see in the following screen. Again, you will see a reminder that you can either enter your labs manually, or if you would like us to help you, you can click on Get My Labs, provide consent to your portal, and we would enter that information for you. And as soon as we are done with that, we would let you know that we have entered your labs and that they are ready for you to check them, to see the updates, and to track them. Regarding the consent, we will be talking about this on more depth, and we will address all your concerns in the future webinar, in our future HealthTree Cure Hub webinar. So be sure to also register for that. If you have questions about how to do it, about what the importance is, and if you have any further concerns, we will address those more specifically in the following event. And if you would rather add them by yourself, you would go to the section on your right. It says, what date did your lab take place? So here we need to enter the date in which we had our lab test results either taken or when they were, when we received them, not the actual date. So we will see an example. First of all, we would have to click on the arrow so that we enter the month. In this case, we chose March, January, then the first and the year. Always be sure to add the date, because if you don't add it, the system will mark an error, a mistake, and you won't be able to save all the lab values that you enter. So the first thing that we need to do is enter the lab date. Following that, we can proceed to enter our lab values. You will see we can begin with the myeloma markers, and for that we would enter the value of each of the labs on the box that you can see right here. And you can see that we also have a feature for changing the units of measurement. In this case, you can scroll down depending on the lab. They have different units of measurement. So be sure to be entering the units of measurement that are reported in your actual lab test results, because these vary from facility to facility and they change the value of the lab significantly if you do not enter it correctly. Again, sometimes it is hard to read, so if you need help, just reach out. We will be able to answer any questions or even help you add them if you require to. After that, we will see that here we have already entered all of our lab values and we entered the correct units of measurement. This is the first section, the myeloma markers, which you already know, or if you don't, you can go to HealthTree University and learn more about this, but these are essential. These are the ones that you need to track over the period of your myeloma journey. These are the ones that you should be looking for, most importantly. Then we scroll down, we see the comprehensive metabolic panel. We have already entered those values. And the last one would be the complete blood count. I want to mention that sometimes you do not have results for all of these lab values, and it's okay. You can just enter the ones that you have. And if it's marking error for some reason, just be sure that you added the units of measurement, that you added the date, and for it to be saved into our system and so that you can keep tracking them, you would just click on save. And after that, you will get this pop-up that says that your labs were saved successfully, and you will receive a question. Do you want to add another lab? If you want to continue entering your labs, you would click yes. And if you are done for the day, you would just click no. And the system will take you back to the labs dashboard. Okay, so that's it for adding new labs manually. We have the second option, which is uploading your medical records. In this case, you would choose this if you have your lab test results either on your computer, in a document, a PDF format, or also if you have them physically, you can also take pictures of the documents and upload them to your computer. You would click here, and let's see what the next screen shows us. This is how we would upload it. We have a big box right here, which says drop file, or click to select file to upload. We would click this big box, and depending on your computer, this is an example of how it must look. We can see that here we selected our documents, and what you need to do is find the document that you want to upload. Find the document that has your lab test results. In this case, we named it labs. After that, you will see a miniature example of the document that you are uploading, and you would click open or save or upload depending on your computer. Something that we need to verify after we have done that, in this box right here, we can see that we have the name of our attachment, labs, and make sure to see that that it has some size. If it says 0, something went wrong and you need to add it again. Then we click on the arrow beside select, and this is very important. You have to select the type of records that you are uploading. In this case, since it's labs, we will select medical records. And after that, we can click in upload records. What happens after that is that we receive those records that you just uploaded into our system. Then we proceed to upload and enter the lab values from the documents that you sent us into the system. And we then notify you that your labs have been entered, and we provide the contact information for you to contact us if you have any questions about the labs that have been entered or about anything else regarding your HealthTree Cure Hub profile. And scrolling down on the myeloma labs, we will see the lab values shown in a graphic. We have the option to show all lab dates, or if you prefer, you can select a range of or a period of time in which you would like to see the lab values from. We keep scrolling down, and we will be able to see on top, we see our lines of therapy. So our treatments, the ones that we have had since the beginning until the present time. This is if you have already uploaded and entered your treatments. We will be able to compare it with the labs that are represented in a graph. So you will be able to see the treatments that you had, and you will be able to compare them with how the labs behaved according to the treatment. This is why it is very important to keep updating and adding as much information as possible so that we can truly see how we have responded to the lines of therapy. Okay, on the next screen, we see there how we can compare the treatments with the graphic. And as we scroll down, we will be able to see, first of all, the myeloma markers. Here we can see an example of the M protein. In the beginning, it was very high, and it has been going down because what can we conclude? That the treatment started working, correct? We can see that the patient in this example was kappa. So the subtype was kappa, and in the beginning they were very high. So this is a very usual and visual way to understand our labs. And of course, if you upload and enter more data into the system, more lab test results, the graphic will be more accurate. And we want that. We want to be able to accurately track myeloma and accurately see how the labs responded to the treatment. So it is very important to keep updating them. Then as we scroll down, we will see the rest of the labs, again, via graphic, the comprehensive metabolic panel and the complete blood count. These are just examples. So of course your graphics will look different depending on the labs that you have. So continuing to the next section, you would be scrolling down until this part. This is the lab values, the same lab values that we saw on a graphic. Now we can see them represented in a table. So here you are also able to edit, to add, or to delete. If for some reason you think some are not accurate, you can do all this here. The table, it's not static, so you can scroll down. We will see right here. We can see all the labs that we have entered, and also we can scroll horizontally, so we can see all the lab dates that we have. As you can see here, it was this year, 2021, so the most recent. And if we scroll, what happens is that we keep on seeing the rest of the dates. So here you can explore all your labs, you can track them numerically, and you can add, edit, or delete any of the lab values. Again, if you have issues adding or editing some of these, you can always contact us and we will be more than happy to assist you with this. Another option to upload your your labs is by using our app, HealthTree Connect and Apple Health. This is for iPhone users, and it's a very practical and convenient way for transferring all your labs from your facility into your HealthTree Cure Hub account. Anna will talk about this in the following session. We also have print summary. The option for printing your summary within the myeloma labs will only print your labs. So if you want all that you're seeing here, the numerical data on the table as well as the graphic, you can go ahead and click on print your summary. It will generate a PDF that you can save on your computer, or that you can even download, print, and take to the doctor if you needed to. You will always have this information right here in your system. And if you want to take it, you can have it anytime you want. And last but not least, you can give consent for HealthTree to enter your labs. We will talk about this in the future HealthTree Cure Hub webinar. We will be able to address all your concerns again, but if you do this, you will be granting us the permission to help you at your lab so that you don't have to do it manually, as we saw in the first option. So the next thing is HealthTree Connect, and we will go ahead with Anna.
Thank you, Patty. That was super clear. So I'm going to explain what HealthTree Connect is and how to use it. HealthTree Connect is our app. It works with Apple Health, the Apple Health app from your iPhone. If you don't own an iPhone, don't worry, we can do it for you. We'll be really happy to do it. As Patty said, you can always call us or email us and we can call you back, or just have communication through email and help you with this. Okay, so the Health app is an app that already comes with your iPhone. It's already installed, so you will find it there. It's this little heart, white square. And once you open it, you will see this screen. You'll have to scroll down to find the section that says Health Records. So I'm going to just explain a general idea of what we're doing. First, we're going to import our lab values into Apple Health, and then we're going to grab those from Apple Health and import them into HealthTree. Okay, so we click on Add an Account, and we look for our facility on the top. Before starting this process, if you want to know if your facility has Apple Health, you can always look for it. Patty or Arturo will copy paste a link in the chat, so you can, that link, it always have the latest facilities. We actually found out that we already have some facilities from Canada and the UK. So for international patients, that's great news. Hopefully your facility will be there. The other way to find your facility is just go to the app and search. In this case, we're gonna do Banner Health. We found it and we're gonna click on it and click on Connect to Account. Then you're gonna add your username and password. This is not your HealthTree username and password. This is your Banner Health username and password in this case, or the facility you have your labs with. They usually give you this username and password when you activate your patient portal. If you don't have a patient portal with them, go ahead and call your facility and ask them to activate one so you can have access to your lab values electronically. Once you've added your username and password, you click on Sign In. Apple will ask you, what would you like to allow access to? What we recommend right now is to give access to everything, since right now we are only doing it for lab values, but hopefully in the future we'll be able to add more information with this feature, including your medications and other information. If you would not like to do that, you can only choose your lab values. And you click on Allow Access and done. Your account has been added. I just want to note here that sometimes it takes a lot of time depends. It can be like 15 minutes to 2 hours. Sometimes we have up to like 2 days. So I cannot tell you exactly how much time, but it takes time for Apple Health to gather all your labs and import them into the app. So what I suggest you to do is, before doing the next step, go back and click on lab results. This is within your Apple Health app. If you click there, you'll see all your labs in the Apple Health app. And if you see the starting date and the last labs that you got, then you're good to go. Everything is there. If it's not, it might be still loading. Again, if you have any questions, you can call us and we'll be really happy to help you with that. Also, you can add another account to your Apple Health app. If you want to import your labs from other facility, I will strongly suggest that you do this and you'll go through the same process. Okay, so once all your labs are in the Apple Health app, the next step is to import them into HealthTree Cure Hub. For this, you have to install the HealthTree Connect app. So you just go to your app store. This is the icon of the app store, and look for the HealthTree Connect app. This is how it will look. And you'll have to click on the download button and it'll start downloading. And once it's done, you can click on open so the HealthTree Connect app opens in your phone, okay? Okay, this is the icon for the HealthTree Connect app. If you wanna look in your phone and find it, this is how it will look like. So you just go ahead and click on it. And you'll be able to add your username and password. This is your HealthTree Cure Hub username and HealthTree Cure Hub password. So now we switch from your facility to HealthTree Cure Hub because we're importing all your labs into HealthTree Cure Hub. So we added that. And we got this big button where you can upload your records. What the app is gonna do, it's gonna take all your labs from the Apple Health app and import them into HealthTree Cure Hub. And it's gonna let you know when the import has been successful. If you want to verify if all your labs are there, you can always go to healthtree.org, sign in with your username and password, go to the labs section and look at your labs. If you have different facilities, this is going to be great because you're going to look at all your labs in one place and you're going to be able to look at the graph and the table. So it's really good to have everything in one place. Again, if you have any questions, you can always contact us. At the end, we're going to show our email and our phone number so you can save it. And now Patty will explain more about genetics.
Thank you very much, Anna. So we will talk about genetics. Again, we will see how to enter the information from your genetic test results into the system. This is also very important as well as the labs, especially in the beginning for the staging and the outcomes of the multiple myeloma, as well as to see the progress. It can also affect treatment options and different things along your myeloma journey. So it's always important to have this in mind, to keep updating them. And here I would like to make a remark. It is a bit more difficult to read sometimes, I think, much more than the labs. So just to remind you that we are here to help you. If you need help with your genetics, either with entering them or understanding your results, we are here to help and we can help you do both. Answer your questions about what they mean, provide you with resources, educational videos, and help you enter your genetic test results as well. So we are back at our dashboard. In order to visit the genetic section, we would go again on the Track My Myeloma. We would click genetics, and the following is the screen that we would see. We can see that we also have some options so that we can enter this information. The first option would be to upload your test records. And again, if you do this, you would be uploading the documents that you have on your computer. In this case, it would be genetic test results. Or again, if you have them physically, you can take pictures of them and upload those pictures. We will receive those attachments and we will enter this information into your HealthTree Cure Hub account for you. Then you can also view the uploaded records. So you have this tool so that you can see if your attachments or your documents have already been uploaded. So if we click there, we will see that these are the attachments that we have uploaded. You will see the test type, in this case, for example, a fish. And on the attachment section, you should see the name of the document that you uploaded. And if you would like to see the actual document, you would have to click on the name. Now, we are going to begin with genetic tests. You can enter fish test results, cytogenetics, flow cytometry. Again, each one of them are very different. They provide different data, different information, and all of it is essential and very important for your multiple myeloma, for tracking it, for keeping record of all your results, and for treatment outcomes, clinical trials, etc. So very important, to say the least. In this case, we will see an example of how to add the genetic tests. We have two buttons. They both do the same. So you would click on Add Test or Add Test Results so that you do it manually, okay? We have two sections here. We can see the test performed. This is the first box that we will see. We have the type of test, we have the date, and totally optional, you can add comments. Sometimes on the test results, especially on fish, on flow cytometry, the pathologist adds a comment. Sometimes it's difficult to understand if we have to add that information on our boxes below. So you can add all that you don't know, if you have to enter on the comments, and we can help you pick what we need and what comments we need to leave there. Okay, and always remember to add the type of test and the date so that you can save them and so that you don't miss your data. Then we would proceed to adding the mutations. Here we have plenty of examples of mutations that patients with multiple myeloma can present: additions, deletions, translocations, trisomies, and tetrasomies. In this case, we will be adding an example of a mutation. So first we would enter the test performed, the date, remember? And here we entered the deletion 17p. This is just an example. In your case, you would add the ones that are reported in your test results. And after that, we have the option of adding the percentage of cells. In this case, we added 30%. And I want to note something here. Sometimes the percentage is reported in your test results. Sometimes it is not reported, or sometimes it is difficult to see where the actual percentage is reported. So you can always add it without the percentage, or again, if you have questions and you would like us to try to interpret your genetic tests, we can help you do it. And in this case, we can see that we already added the mutation. That's how it would look. And we click on save so that we have that information. This is how it would look. You can see that we have the date, the type of genetic test. In this case, it's a FISH result. You can see that it shows the deletion that we added with the percent. And even if you have already added a test and you want to edit it or add some notes, we will be able to do so, and we will see an example. So we have the option to edit or remove this FISH test. If you believe that it's wrong or you want to change it, you can edit it or remove it, and we can add some notes. So we would click there on edit, and we would see the same box that we had again, but now we can add the comment that we want in the box below the date. In this case, I added the word hyperdiploid, which is that sometimes it is reported in the FISH test, and we don't have that option on our scrolling section, so we can add that in the comments, for example. And in order to save that, remember to click the button update, and now we can see that it has been added into our results. The record has been modified. You will get that notification, and you will be able to see all the notes that you add, besides the results from your FISH test or your cytogenetics or your flow cytometry, depending on what you added. It is very difficult or sometimes overwhelming, the amount of information that we have, especially genetic information. So if you click there, you can see that based on the genetic results that you enter, you can see what they mean. What is the relevance to your disease? What is the relevance to myeloma? In this case, we added a deletion 17p. So when we click on what do my results mean, we see the explanation of that. But depending on what you enter, you would see the explanation of the mutations that you entered. So this is just an example. Of course, you would receive the information for your specific mutations. So it is very important to enter them correctly so that you get the accurate information and see why is this important for my myeloma. And of course, you can keep scrolling down and you can learn about all the types of mutations that are very common within myeloma patients. You would just click on read more in each of the questions, and you would get information about all that. And on the bottom of your myeloma genetics, if you still want to learn more about genetics, you can click on learn more. You will be able to enter HealthTree University. There's a series of online courses, and it will help you understand genetics better. Not only genetics, you can see videos, educational videos about everything about myeloma, all for free. And remember, this empowers us as patients. Every time we learn more, it's being more empowered to take informed decisions. So I would strongly encourage you to click on Learn More and go to HealthTree University and learn about it. And that would be it for genetics. Now we'll go with Anna.
Thank you, Patty. Okay, so this is great. Now that we added all that information, you might want to print your summary, either for your personal records, or again, if you're having a consult with a myeloma specialist or asking for a second opinion, this is a great resource to take to your doctor. He'll be able to look at all your myeloma in just a few pages, so it's great. If you want to print kind of like a general overview of your myeloma, once you are in your dashboard, on your left, you'll see a print my summary option, and you click there and you'll get a PDF. So what does this PDF contain? We have your personal information, the fitness level, your current physician, all your disease history. So when you were diagnosed and the type of diagnosis that you got, when and where. And if you have different diagnoses, so if you got diagnosed with a small learning first, it will appear there in the date. So that's super informative. Also your genetics. In this case, we are seeing a flow cytometry and then a genetic test, a FISH test with the deletion 17 that Patty mentioned. And your high risks values at diagnosis. Your specialist might want to know this information. We have some of your myeloma labs right here, but we have a better feature for that I'm going to show you in a minute. Lastly, you'll see all your treatments, all the dates, all the type of treatment that you got, if you reported any side effects, and the outcomes. So this is super useful, again, for your doctor, or even for you if you want to have it for your records instead of having all your medical records for with pages and pages. You'll just have a few pages with all your myeloma history. And then if you want to print your labs, I would suggest this feature that shows a more detailed picture of your labs. So what you have to do is, again, in your dashboard on your left, you click on labs and you'll get this screen again, the one that we already saw with Patty. You click on print summary and it'll give you two options. You can either print your graphs and the table, or only the table with no graphs. If you're trying to save some ink, you might want just print the table. Depends on your needs and what you want. In this case, I selected both and I click on print labs. It gives you the option to print it or to save it. You can save it as a PDF if you're sending an email or you just want to save it in your computer. So you can print or save, and it will ask you for the name. In this case, I typed labs, and again, you click on save, and that's how you save it, as a PDF. All right, so this is how it will look. This is just part of the PDF. You'll see the graph. Again, your lines of therapy will be on top, and that's great because you can compare your labs with your lines of therapy, and you'll get all your lab tables here. If you have a lot of dates, you'll get them in different pages because it's impossible to have it all in one, but it's great. It comes horizontal and you can just put them together. And that's, for example, those are 2 pages. That's how it will look. So thank you very much. We'll proceed to questions. Before that, I just want you to know that, again, if you need assistance, you can contact us. We'll be really, really happy to help you. We have a great team. We love talking to patients. You can email us. We can schedule a call. You can ask us to call you, or you can call us. We also have a chat feature inside of HealthTree on your bottom right that you'll find it. So feel free to contact us. We'll be really happy to help you.
Awesome. Thank you, Anna, and thank you, Patty. That was a great presentation. I feel like it was super clear. You can feel free and stop sharing now, and we'll turn it over to questions. And let me just tell you that Anna is very serious. Their team is so awesome and so helpful. So please reach out. I will be including that contact information in our follow-up email that will include the slides that we shared today, as well as the recording, and that will come 24 to 48 hours after we've finished. So I see that Todd would like to answer the question concerning when is this going to be available for Android users? I know that's a super common question. So Todd, if you want to turn on your camera and answer that question for us.
So Android users and HealthTree Connect. So as of right now, it won't exist for Android users. I'm sorry. We'll get straight to the facts. It won't exist, and the reason why is Android has not worked with the clinical facilities to connect with their medical records so that they can be downloaded. Apple has worked for over 5 years with many different clinical facilities to connect with them so that the labs can be downloaded to the phone. And then in turn, HealthTree Connect picks them up from the phone and brings them into HealthTree. So Android doesn't have that connection right now. And I've not heard of plans of that. It doesn't mean they won't, but it's not all bad news. There are other ways of getting labs into HealthTree, and we are working on that right now that would not require a phone. It would work just with a computer, any type of computer. We are working on some of those ways so that you have other options of getting your labs automatically into HealthTree.
Great. Thank you so much, Todd. Okay, so Patty, do you want to answer the question about antibodies? Or is that what that says?
Yes, so they were asking about COVID-19 and multiple myeloma, specifically about the vaccine. So actually we have 2 posts about that. I already shared the links for you all to be able to read it. But as a summary is yes, not all the percentage of people that have been vaccinated have developed antibodies. This happens in people with multiple myeloma as well as with people without multiple myeloma. So it's of course not 100% sure that you will develop antibodies. It is recommended though that you get the vaccine as soon as possible if you have the opportunity, and to keep the precautions because you don't know what part of the percentage you are. So go ahead and read the links that I sent you. They are very resourceful. We are also on the second part of the COVID-19 study, and we will get more data as the pandemic unfolds. But be sure to read those articles because they are extremely resourceful.
Thank you. Let me add something interesting. We talked to Dr. Nina Shah yesterday, and she was talking about the Abecma ide-cel CAR T therapy. But this question of the COVID vaccine came up because it's a hot topic, and the COVID antibodies. And one of the ways that she was explaining it was they might just be looking at the wrong thing in the test. It doesn't necessarily mean you don't have antibodies, but they're looking at a certain cell. I think it's the B cell, but your T cells might be working towards the antibody in a different way. So I will also include that recording in the follow-up email just because A, it's a fascinating presentation from Dr. Shaw, but B, I know that we're all interested in what happens if my results say that I don't have the antibodies. And a multiple myeloma specialist yesterday said, still get the vaccine, as Patty said, because that doesn't mean, just because it's not showing up on your test doesn't mean that you might not necessarily not have those antibodies. So interesting thing. Let's see, we love all your questions. A frequent question that I'm seeing is they update it, but then they don't see it automatically. So Anna, do you want to respond to that? That why do they update it, but it's not reflected?
Yeah, so this is not an automatic process. Once you upload your records or your labs or your genetics, what we do is we have a waiting list. We download them and we enter them carefully. If you have an appointment coming soon, or if you need to take treatment decisions, we'll be really happy to do it for you as soon as possible. Like, we can do it on the same day. We just need you to either email us or call us so we can know that you are a priority, and we'll be really happy to do it. So we just have a waiting list, but if you need them there, we'll be really happy to do it. So it's not automatic. That's the reason why. And then someone else is like, you have a lot of questions about if that is something that we do periodically or not. So what we do, and we're going to explain more about this in our next webinar, but just so you have a general idea, we do a validation process with each patient that shares records with us. So all the information is validated by our team, and we do that once a year. So we do it this year, and a year from now, we're going to revalidate. We're going to complete all your information and see that the information that you've added is correct. But again, if you need help, we're here to do it. Like, we just cannot be updating all the information for every patient right now, especially since we have a lot of processes that are being manual. And that's also another exciting thing, that we have some things coming, so we can do it more efficiently. So just communicate with us, tell us your needs, and we'll be really happy to help you. We cannot do it for everyone, but if you need it, we're here for you. Just let us know and we'll do it. If you don't, it's a once a year process. And someone else asked about your consent, if you have to give consent for every facility, and that the answer is a yes. So it's not a consent that you have to give every time you go to a consult. It's a one-time thing, but you have to give it for every facility that you have. And again, we'll explain more about this in our next webinar, but if you want us to explain in more detail, just call us and we'll be really happy to do it.
Great, thank you, Anna. And I see a question saying, okay, there is a delay between my uploading and then putting it into the system. You guys will notify them when it is uploaded, and then they'll be able to see all of the features that we talked about today. Is that correct?
Correct. And we'll also include a link so they can schedule a call with us if they have questions about their information, or they just want us to explain more about what it means.
Yeah, great. I think it's just a testament. We don't want you guys to go through this myeloma journey alone. That's why we've created what we've created. That's why we do what we do. So please don't wonder what your labs mean or get frustrated because you're trying to keep track of everything. Let us help you. I guess that's my plea to you guys. Patty, did you want to answer a different question?
Yes, so they just asked us, are the features presented today available after all my data is entered? Especially because you had your data entered in January and it's being updated for the HealthTree study. Yes, that is correct. Some of the features get active as soon as we validate your account. So once we have entered all the information on your account and we are revalidating so that you can enter the study, you will be able to make use of all the features that we have in HealthTree Cure Hub. If you have any issues with any feature, you can contact us so as to see if there is a specific issue. But as soon as your account is validated, everything should be up and running, everything that we showed today.
Awesome, thank you guys. We have time for a couple more questions if anyone has anything. If not, we can finish up. So I'll wait just one more moment and kind of talk a little bit more. They touched a little bit on HealthTree University, but I'm going to talk a little bit more about it. HealthTree University is the way that I have seen scared patients convert into empowered patients. They are videos that are relatively short, or some of them are long, but you'll be able to see that they're long when you start. And there's even questions after the video. So it's not just watching a video, it's learning from a video. There's fun graphics, so it's not boring, and things are usually explained in a simple way so that you're able to comprehend what in the world is going on in this myeloma world, what's going on in your journey. So I highly recommend that you go to HealthTree University and educate yourself, because that will help dissipate fear and will also help you feel empowered. Anna, would you like to answer the questions that have been coming in? I can't hear you if you're talking, Anna, because you're muted, so you might want to unmute.
Yeah, sorry. Someone is asking about the graph, how to access it to see your labs in a graph. So again, you go to your dashboard. Once you've logged in, you click on labs. Oh, my internet's slow right now, so I'm going to show it here again. Okay, so let me present this. Whoops. Okay, so here under your dashboard, you see Track My Myeloma. And then what you do is you click on labs and you'll get to this screen. If you haven't added any labs, you won't see any graph right now. You'll see just like an empty graph because you haven't added any values. Again, we can help you with that. But once you've added those values, in that same screen, the only thing that you need to do is scroll down. So once you added your labs, if you scroll down, you'll get to the graph. You'll see your, again, you can show all dates or just the dates that you would like to see, and you'll see all this. If you want to print it, on the first screen here, you click again, dashboard, labs, and print summary. And you'll see it all in a PDF. You can save it in your computer or print it.
And if I can interrupt there real quick, I'm not sure if you're logged into HealthTree Cure Hub right now and trying to look at your labs, we actually have an issue going on right now where it's not showing any of the lab information. So I don't know if that's what the person was asking, is where did my labs go? Nothing is lost. We've checked, all the labs are there in the database. It's just a bug how it's presenting, and the developers are working on that right now. So if y'all go into Cure Hub, you're not going to see your labs right now. I apologize for that.
Well, I'm glad we have you here, Todd, to help us know what's going on. Somebody else is asking, we mentioned another webinar in the series, is that scheduled yet? It's actually scheduled for September, but I'm realizing that's pretty far away, and I want to educate our patients as soon as possible. So we might move that up. We're probably going to move that up to July. I just have to check Anna and Patty's schedules, but as soon as that's out, I'll make sure to coordinate that before that follow-up email is sent tomorrow. And have the date for you so you guys can mark your calendars. Okay, Patty, if you want to answer that last question about validation, and then we'll finish up for today.
Yes, so what you need to do is to provide consent for us to ask your facility for your medical records. This is actually what the next webinar is going to be about. You can do that either by going to the lab section and clicking on Get My Labs, or click on Provide the Consent, but that's the way it works. You give consent for us to ask your facility for your medical records. They send the medical records, and what we do is that we verify that the information in the patient, in your HealthTree Cure Hub account is accurate, and that if anything is missing from your medical records that your doctor has, we put all that information into your account and we validate that. This is very important, especially for research, so that it can have scientific accuracy. So that's the way that we validate your account.
Perfect. We're getting a lot of thank yous coming in, and the real turnaround is thank you to you guys, because without your data, we wouldn't be anything. So we really do appreciate the contributions that you've made to this product and platform. I'm grateful to the HealthTree Cure Hub team, the patient engagement team. You guys are awesome. It's so exciting to watch people use our product because it makes all the hard work worth it. So thank you so much. And Patina, that was such an organized, simple, not simple in like the easy way, but simple in the clear presentation. So I'm really grateful for that. We will include the phone number in the follow-up email. And I think Todd's writing it right now too as well, for those that are asking for the contact information. We'll finish with just a couple more slides and then we'll be done. So our next session in the Connect with the Myeloma Crowd Chapter. So I know this is kind of confusing that there's a HealthTree Cure Hub series within the Connect with the Myeloma Crowd Chapter, but our next session within the Myeloma Crowd Chapter is on May 26th. That's just next week. That's also at 3 p.m. Eastern. We're gonna have Greg. He is the director of the Myeloma Roundtable program. He's going to come give you behind the scenes of how we get myeloma experts to come speak to us in those Myeloma Crowd Roundtables, as well as show some highlights from this year of what we've learned from the specialists. There are also other upcoming events in the Myeloma Crowd Community program that you might be interested in. I've listed them here. Tomorrow we have a newly diagnosed myeloma patients chapter event where we're going to have a panel of medical professionals and veteran myeloma coaches to talk about how you can become an empowered patient. Then Thursday, we're launching our Spanish chapter. So if any of you are Spanish speakers, we are launching the Soporte para Pacientes chapter on Wednesday, May 26th. We have the selinexor support group. We're going to have RN Molly Oswald talk about how to manage the major side effects of XPOVIO or selinexor. Then, as I mentioned, we have the Myeloma Crowd Roundtable. We have our African American myeloma chapter on May 27th. And then on May 28th, we have the Nutrition and Wellness for Myeloma chapter, where a radiologist from Cornell is going to come talk about the imaging manifestations of common Western diseases. And I forgot to mention the African American myeloma chapter is with Danielle. She is going to be sharing her stem cell transplant experience because they happen all the time, but they're very unique and we need to be sharing more stories. The link to sign up for those events is found at the bottom of the slide and will be included in your follow-up email as well. And then thanks to our community sponsors, again, Bristol Myers Squibb, Amgen Oncology, Karyopharm Therapeutics, AbbVie, Adaptive Biotechnologies, Genentech, Oncopeptides, and Takeda Oncology. And thank you to each of you for joining us today and for helping build the strong Myeloma Crowd community. We couldn't do it without you. We hope you have a great rest of your day. Thank you.